Good afternoon, everyone. Thank you for being here today. My name is Pauline Matindan Garcia. I am the Director of Care Transition for Livingston Memorial, DNA and Hospice. I will be moderating today's presentation, and today's topic is all about caregiving. But before I begin and introduce our speakers, I want to go over some housekeeping notes. Today's session is being recorded and will be available for viewing on our website in about 24 to 48 hours. If you have any questions for our speakers today, please use the chat function on the Zoom app. It should be on the bottom portion of your screen. Type in your question, send it over, and we will go ahead and do our best to answer all the questions during the presentation. All the questions and answers for the question will also be posted along with the recorded session on our website. Lastly, if you have any technical question, please use the chat function as well to send in your question, and we'll make sure that we'll have our technical support team to assist you with any troubleshooting issues. So today we're talking to John Macias and Catherine Mays. They lead up our Livingston Caregivers department. So John is a leader and an expert in non-medical home care. He joined Livingston in 1990. And while John held a variety of roles within Livingston, his true passion came to light when he transferred to our Caregivers department in 2005. John finds fulfillment in knowing that he can help our clients pave the way for them to remain in their home safely and with dignity. And John has been spearheading our Caregivers department since 2005. In his personal time, John enjoys spending time with his daughter and cheering on his all-time favorite basketball team, which I know he's having a wonderful season this year, the Lakers. Go AD, right?
Go Lakers.
Go. Now, we also have our wonderful Miss Catherine Lamb Mays. Catherine joined Livingston in 2010. Similar to John, Catherine wore many hats within Livingston before finding her true calling in caregivers. She has been a caregivers manager for 8 years and really responsible for the day-to-day oversight of the department's operations. Catherine earned her bachelor's degree in healthcare administration, and she is a long-term resident of Ventura County. When Catherine's not helping our clients, she's most likely spending her time with her family in her cowgirl boots and running their business cattle. So between them, they have over 26 years of experience working with families to find the right caregiver solution. And they're here to answer the most common questions that we receive from community members about caregiving. So let's get started. So John, Catherine, once again, thank you for being here. And as Director of Care Transition for Livingston, one of my primary responsibilities is to help our patient navigate their options once there's a big declining condition. And I get a lot of questions, not just about home health or palliative care or hospice, but what about caregiving? How is that? What is the role of a caregiver in a post-acute care setting? And what I did is I came up with like the frequently asked questions that I encounter, and maybe we can get started with John. And so the number one question I get is, what are some of the warning signs that it's time to consider hiring a caregiver?
So typically this is for adult children who are looking in on their mom or dad. And I personally have encountered this. I know Catherine has, and we all will at some point. But you just see warning signs, things that maybe their hygiene is kind of devolving. They're no longer showering when they're supposed to. You see they're losing weight. They've taken falls, and falls become more consistent for them. They're having difficulties with just getting dressed, undressed. You see their balance is kind of taking a slide, and you see the way they walk. They tend to lean to one side sometimes, or just getting to a standing position. You see that there's a little bit of a wobble that takes place. Those are some good signs. There are many, but those are just some key signs that people can catch on to when you're visiting your loved one.
And just to add, also a key sign is the loved ones that are taking care of the senior. Many times their health starts to fail because they're focused all on the person who needs the most care. So
Family, caregiver,
Right.
burnout, absolutely.
exactly. So if you see your parent who is the primary caregiver, or your loved one who is the primary caregiver in the home, if you see that their health starts to decline, that's probably a good time to start looking at the possibility of caregivers.
I also, and I can personally relate to that family caregiver burnout. And it's actually a conversation that I've had to have with my mom when it was time to care for my grandma who was on hospice. And what do you see are the barriers when initiating those conversations?
Just trying to get through to a senior. Aging is difficult, and so there's a physical decline, and sometimes the mental decline doesn't match the physical, and sometimes as a senior, they're thinking they can do what they used to do, and we don't all have that same radar or self-perception to kind of understand that our body is declining, and that's when it becomes problematic. As a child. You have to go in there with empathy and have a frank and honest conversation with them. The senior is going to be the biggest barrier most times to service, and so you just, as a person trying to get someone to take that option and have care come into the home, you just have to be very empathetic with them and talk to them in terms of kindness. We've seen some of the other things that happen where family members go in and then the adult children get a little more aggressive. They're frustrated because mom and dad won't accept it. That rarely works. And if it works, it might work short term, but it's better to get their involvement and try to get them to see that it is needed.
And also not or make sure that they know that the caregiver coming into the home isn't going to just take over everything. Okay. So a lot of seniors that we speak with, they're afraid of losing their independence. Of course, they've lived wonderful lives and accomplished a lot of things, and they want to be independent, and we want them to be independent. So our caregivers who go in to the home, or any caregivers who go into the home, they don't want to take away their independence. They want them to remain independent by just helping them. So rather than, sometimes we have clients who they want to do all of those housekeeping tasks, like making the bed, doing the dishes, doing the little daily things. But then they fatigue quickly. And so what we suggest is having the caregiver help. So rather than make the full bed, you do one side, we do the other. Okay. And so that way they are able to
have ownership of their tasks. So can you dive more into that? What exactly are the services involved in a caregiving service?
Sure. So our focus is activities of daily living. So those are just things like helping someone bathe, if they're having difficulties with ambulation, being there to help them with walking, transfer. So something as simple as getting to a standing position or a seated position, getting them safely in and out of the shower, things like that, helping them get dressed, helping them get a meal. And then we go into IDLs where we're doing some light housekeeping, we're doing some transportation or doing some errands on their behalf.
And what is IADL, John?
Instrumental activities of daily living.
Okay.
Yeah.
So what about, and I've seen this where I would meet with patients, right, on our care with palliative or home health, and I would ask, when was the last time you were seen by your physician? And usually the senior's living alone, right? And they'll say, I haven't, because I have no way of getting there. I'm not able to drive. And COVID may have changed that a little bit, that they're able to do telehealth, but as we move away from the pandemic, and we're going back to our traditional in-person physician visit, will a caregiver be able to provide support of for the seniors seeing their physician and receiving care appropriately?
Yeah.
Okay.
Yeah, we were able to transport the senior to the appointment, whether the caregiver can drive their car or they can drive the senior's car with the proper paperwork in place.
Okay.
But they can definitely assist with that.
Okay.
And also be respectful of their wish. So if they would like them to just help them inside and they go up back to the appointment on their own with their physician, that's fine. Some clients do like their caregivers to be with them during the appointment. That way they can listen. They can sometimes take notes and give them to a family member or, so.
It seems like it's very widely encompassing. There's a lot of services that are available. And another common question that I get is, what are the minimum hours? How much hours do I need to secure in order to get a caregiver?
Well, that it depends. You can it's up to the family. It's up to the client, the senior. Different agencies have different minimums.
Okay.
So I definitely suggest that's a question to ask whatever agency that you call, because some do have certain minimums. But really, it's you look at what we suggest is looking at the time of day that you need the most help, whether that's the morning and getting up and starting your day, or if it's the evening, or if it's in the middle of the day, looking at that time and then basing the hours off of that.
Of the need. Okay. Now, what happens if the senior client gets hospitalized? Does the caregiving stop? What does that scenario look like?
Postpone is a better word. So
Okay.
we postpone services and with the thought that they are going to come back home. And so we let the family know to resume services, just call us and reinstate service, and then they get their same team back at that point. So there's not really a stop in service unless it's absolutely necessary, meaning they're not going to be coming home for a prolonged period of time. So,
Okay.
yeah.
And at families' request, and I've seen this when I go to the hospital and I meet with patients, I would see a caregiver there. Mostly, it seems to me that they're offering just companionship and being there. Is that a normal thing that a caregiving service would offer?
Yeah, so like John said, normally we postpone service, but sometimes families do like someone to be there. Perhaps the family is not able to be there with their family member the whole time, and they do want somebody there around the clock. So we would then step in and just care wouldn't stop. We would just our caregiver would go to the hospital, or a caregiver can go to the hospital, and not we wouldn't provide care. But be more of an advocate, make sure that if they need something, the nurse is called, or a family member knows.
Yeah, and I think that's a great service, because what I've seen caregivers do, they're able to provide history for the providers in the hospitals of asking like, how often do you take your medication, and sometimes like the senior patient is not able to answer those questions, but having someone who can advocate for them when the family's not available is definitely a big help.
Exactly.
So absolutely.
Like Catherine said, most times that happens. We have a lot of adult children managing their parents, and they live out of state, as far as out of state, in another state altogether, and so that works out great for them in most cases.
That actually brings me to the next question. I know we have a lot of patients who their loved ones are living in another state or another city, and they live in an assisted living facility or a residential care facility. Is caregiving able to provide care in in an assisted living facility?
Yes.
Okay.
Yeah, and a lot of times it's the assisted living facility who will prompt the family to do that because you have to meet certain criteria to be in an assisted
Okay.
living. It's meaning that you are independent to a certain level. And when seniors age, they tend to drop under that benchmark, and then they'll ask the family to get caregiving into the facility. So yeah, we do that quite a bit.
Okay.
There's not really any barriers there other than if there's a certain way that particular independent living community wants things done, but the care is provided just the same as it would be in a home.
Okay.
Yeah.
Now, what questions should a family who's starting to, interview caregivers, right? What questions should they be asking a caregiver or a caregiving agency?
Obviously, finances play a role.
Mhm.
That's something they want to know. Everybody should be asking that so that they know what financial commitment they're getting into for their
Okay.
loved one. A lot of the questions we get sometimes involve scheduling. You brought that up earlier, and Catherine spoke to that. But a lot of times people get confused with that, so it would be good for them to ask about the scheduling, how that's done, and then also ask about minimums, which that was brought up earlier. And then even what we touched on earlier, the types of services, you want to make sure that you have a good idea of what services the agency is going to be providing to your loved one. No surprises is always best, obviously,
Absolutely,
and
yeah.
they will happen because seniors, their health evolves for better or worse, and sometimes it's peaks and valleys, and so you'll change the plan that you originally started with. So but gathering as much information as you can up front and then asking what you ask. Don't be afraid to ask the agency that you're calling, what kinds of questions should I be asking? The agency knows, so it's really good to lean on the professional, so to speak. It really is kind of overwhelming. I, again, had firsthand experience years ago with my grandmother looking for care for her, fell on my plate at one point, and so you don't know what questions to ask, so it's okay to just ask the agency that question. What types of questions should I be asking? So that you feel comfortable at the end of that conversation knowing exactly what you're going to be getting for your loved one.
It's also a good question is whether that agency, home care organization is licensed with the Department of Social Services, as every home care agency should be in
Can you
California.
talk more about that, Catherine? What's the difference between an unlicensed and a licensed caregiving agency?
So a licensed caregiving agency is just licensed through the Department of Social Services in California. That is, as every home care organization should be in this state. They oversee the home care services, and so the home care organizations that are licensed need to meet expectations and requirements that are set. There are education requirements. Every caregiver has to be registered with the state as a home care aide, and so there's just certain expectations that have to be met as a licensed home care organization.
Okay.
And those are all benefits to the senior. All those regulations
Absolutely.
in place are for seniors as an added layer of protection. And as Catherine said, when caregivers are registered, they go through a fingerprinting process.
Okay.
And those fingerprints get sent out to the FBI and Justice Department, which is again another added layer for seniors. Yeah.
Absolutely.
Yeah.
Now, I know from first-hand experience when my grandma started hospice care, my family started, we basically just piecemeal the caregiving aspect of it. And that lasted about maybe 2 weeks until just, there's caregiver burnout and just, it turned very contentious. It's just everyone's tired.
Right.
And we had a good family member who was able to, a family friend who was able to, we were able to hire her as an independent contractor. And it worked out really well for us, but I know that's not the case for everyone, right? And so can you talk more about that aspect of caregiving where an independent contractor versus going through a caregiving agency?
Yeah.
No, go ahead.
Really it's each family needs to do what is best for them. And in one setting, hiring an agency is the best thing. And in another setting, hiring a private caregiver is better for that situation. So there's they are a little bit different. One of the big differences is that as hiring a home care agency, you are not the employer. The home care agency is the employer of the caregivers. So they handle all the employer responsibilities, payroll, scheduling, communication, anything that may come up. If let's say there's some things that you'd like the caregiver to do differently, but you don't want to approach the caregiver. You call the agency and you talk to them and they talk with the caregiver about that.
Okay.
That way, when the caregiver is out in the house, it's not contentious. It's
Yes.
You have to be careful about that relationship in the home. Hiring privately, you would have to be responsible for all of those things, which some don't mind. They want to be, kind of in control of the scheduling and not have to go through an agency for all of that, and that's okay. But that's probably the biggest difference, and is just having the home care organization be the employer and handling all of those responsibilities.
I think there's true value in that of having the caregiving agency as the safety net of having to manage those dynamics, right? And I think, there was a time where I was working full-time, my mom's working full-time, and we depended on this one, right, caregiver, and all it took is like, she was sick and she couldn't come in.
Right.
And so someone's got to give, right? So it's almost, it's nice if you have a caregiving agency where you just call and she can't make it. And it's like exactly that it's that dependability and flexibility of having backup agents, caregivers.
Right. Just the lack of oversight that you might have hiring privately, it can be a big turnoff going that direction. And, with employer responsibilities, that's a big word that encompasses a lot. Catherine touched on some of them, but, as an organization, as a business, you have to have all of these things in place for the what ifs. And if you're hiring somebody privately, and that doesn't go away, you're still liable for those when you say you're going to be the employer. So workers' comp insurance, if someone
Labor
gets
laws,
all those different things, paying taxes, making sure taxes are handled properly. Those are all things that you have to do. I'm not saying you shouldn't do them. Like Catherine said, it's a personal preference on what works for you and what's going to make it viable for you and your family to get care.
Now, and I'm sure this is probably one of the number one questions that you receive when you get like a cold call. How much does it cost and how is it funded?
So it's an out-of-pocket expense. There's one insurance type of insurance right now that covers caregiving, and that's long-term care insurance. And that's a private policy that you would purchase as an individual. And it's a policy, so every policy is different, just like car insurance. You can upscale and what have you, and with that. So, but predominantly, unfortunately, and I say unfortunately because I feel like it would be great if other insurances picked up the cost of caregiving services, because I think it is it's a catch-all net caregiving. You get to be in the forefront of when, again, someone's aging and something occurs health-wise that needs to be addressed. The caregiver can be there to help that and hopefully prevent a catastrophic incident by having some additional care there. But predominantly, it is just out-of-pocket expense currently, and every agency has a different fee associated with what they want to charge.
Okay.
A lot of agencies are private companies, and so everybody gets to set their own benchmark for pricing.
Okay.
Yeah.
So pricing wise, and I know you mentioned it varies with every
Mhm.
agency, but is there a standard price range that our
Mhm.
community members should expect from a standard caregiving company in our county?
From time to time, we look at that because
Mhm.
we want to look to see, where as a company, like ours, we want to make sure we're in a good median in there with everybody. So I would say right now it's probably between $30 to $40.
Okay, an hour.
That's the range right now that we see.
Yes.
Okay. Now, how does one get started with
Mhm.
hiring a caregiver?
It's a call. You see a need, you call. I always recommend that I recommend this to people that call, and I'm their first call. I always recommend they call several agencies so that they can feel comfortable. Again, it can be an intrusive thing to have a stranger come into your home. And for seniors in particular, they grew up in a different era. And again, the mindset, the switch they have to be accepting of care coming into the home. There's a lot there. So off the top, you want to try to get a company that you're comfortable with. I would say you would, as a consumer, you would want to call, 3 agencies, and knowing your parents, if you're an adult child and you're trying to arrange this for your parents, I think most seniors prefer to have someone come out and speak to them in person. So you might want to ask the agency that, can you have someone come out and speak to us as a family and speak to my parents? I think that always works best.
Mhm.
And then call when you know you want to have service and you've got your parent online with that and saying, yes, I'm going to be accepting of this. Then call with a schedule. That's so important for agencies to
Okay.
know what your thoughts are. Every agency that I know of is always struggling with staff. So you get so many people calling you, you have so many caregivers to utilize. So there's always a barrier you hit.
Mhm.
And so you want to call with that schedule. It helps the agency to determine right away so they're not preoccupying your time, to let you know if they have staff. And that's a big key factor is the schedule for an agency to know if they have enough staff.
And also, the schedule, an important piece to caregiving is just being comfortable with the senior being comfortable with caregiving. It can take one visit a week to start, and that's okay. It does not have to be every single day, 8 to 5 or 24-hour care.
Right.
A lot of times clients or families will start small just to get comfortable.
Right.
And so a schedule that is, maybe a couple times a week, 3 hours a day, 9 to 12.
Yeah.
That's okay. And most agencies are flexible to increase care or decrease care at any time. So you don't have to, when thinking of a schedule, it doesn't have to be something that's
concrete.
Right.
Yeah, absolutely. That leads to my next question, because when I meet with families and I could tell that caregiver is will be a beneficial support for them. As soon as I bring it up and I'll say, someone will call you and they'll say, wait, what does that look like? What are you gonna do? Are you coming to my house? So can you walk us through on what that looks like? They set up an appointment, you come into their home, and whether that's an assessment or an interview, what does that process look like?
So if it's from the starting point of they want to talk, just to speak with somebody about care, then most of the time, they call And John or myself or both of us will go out and talk with the family, answer any questions from the clients, from their family members. Sometimes they have us on speaker with all of their kids all over the country. And just everyone's asking questions and getting comfortable with it. Then they usually talk as a family unit, and we'll call back with a schedule. Then we would work on that schedule, find a caregiver or caregivers if it's a schedule that involves a lot of shifts. Then once we have a caregiver in place that can work that schedule, then we would go back out to do the paperwork. So consent paperwork, create a care plan that goes over the tasks that the caregiver is going to be doing in the home. That way they know what to expect, have a little bit of a starting point prior to entering the home. And then after that, it's off to the races.
Now, and what do they do? What do families do when service is started for their loved ones?
In terms of
What should they expect?
so just that the caregiver is going to meet that schedule, that the company will have a caregiver there on the days and times that they selected. Typically, most agencies I know will put a log in the home so that the family can read as they come to visit, kind of how things are going with mom and dad. So we can impart that as well, and they can always call the office too to hear how mom and dad's doing if they have specific questions. Most companies are going to be open to that. It's part of what the caregiving services offers. And then there needs to be time. Time needs to be given so that a rapport can be built between that caregiver and the senior. And that timeline is different for everybody, but I'm comfortable saying that within 2 weeks.
Of
just having somebody there. You touched on something earlier, Pauline. You said that a lot of seniors get isolated in their home. And you touched on that with the pandemic, but that's true for seniors, period. They're not as mobile. They don't have the energy they once had. So they wind up confining themselves to their home, and having somebody come in to talk to, and even somebody to get a little mad at times, is really, really helpful. It's really a mental health piece there for seniors that helps them. And once you can show your emotion to somebody and the other person on the other side receives it, that starts that process of bonding. So
do you I keep circling back to my personal experience, and I always wonder, like, is this the same for everyone or for most people? When we started to hire a caregiver and she started working, it was really hard for my mom to let go. And there's a lot of dynamic there that it's, mom, take a step back. Remove the caregiver hat, put on the daughter hat, and allow yourself the time to just be with, we call her Lola, that's how we say Grandma in Tagalog, and it was hard. Is that a common thing that you see as caregivers start to go in and establish rapport with seniors?
Absolutely. So when we say that same thing to families, take your role and, take off the caregiver hat, give that to the caregiver, and take your role back as wife, as daughter, as son. So, and sometimes it can be a struggle. And to be honest with you, a lot of seniors want their loved one to wear that caregiver hat. So there's more of a struggle there, because even when the person is willing to let that go, they may be pulling them back in. And that's a natural thing. There's nothing wrong with that. There's nothing like family caring for family ultimately. So, but again, it's that trust piece. And once they develop that trust, they're going to be more open to the caregiver providing that care.
Great.
Yeah.
Now, I've asked all the questions, and I want to know, in your combined 26 years of experience, what do you feel like, I wish families would ask us these questions when they're interviewed?
I think for me, it would be kind of expectations. So if families would ask, you've been good about that, but if families would ask that, what are healthy expectations that we should have? And expectations are going to be different for each family because we're dealing with seniors with different issues. So I would, again, encourage families to ask that question of the service that they're bringing in. It doesn't matter what service. I think that's good to ask of any service that's coming into your home. What are good expectations to have with this? I think that's something that I wish families would do more so that we can kind of delve into that with them a little bit more.
Right.
We try to express that to them, but in the timeline that we have with them, they have a lot of questions. So a lot of times we're answering things from different directions. So that would be a good one for me.
Yeah, because it also then goes into just understanding too what caregivers can and can't do, what the agency can and can't do. And that's really important to understand, because then, there's service just goes a lot smoother.
Absolutely. Can you both touch on that a bit more of what can't caregivers do? What are they not outside of their scope of practice or responsibility?
So the caregiver arena is non-medical, or what they call custodial care. And so that means that they're not, a lot of times people think that's overlapping with the medical side, with a nurse or what have you. There is no training for a caregiver on that level. You wouldn't want a caregiver taking care of your family member on that level. They just don't have the training. So, so just knowing that, caregivers aren't allowed to administer medications. They're not allowed, we've even had people ask, can they insert or remove a catheter? No, they can't do. Pretending to know what they're doing, in particular when it comes to the health of your loved one, which would cause, obviously, you can have a big setback there. Anything else you can think of? Can't?
Wound care, cannot provide wound care, which goes into that medical aspect. As far as John said, as far as administering medication, just a note that pill box usually will take care of that. Caregivers cannot fill a pill box because that's dispensing. So normally if a client's family is asking about that, then we suggest a pill box. But we are not, caregivers are not allowed to fill the pill box or take medication out of a pill bottle.
Okay.
We don't do home construction. We don't paint. Over the years we've gotten
wash windows, all the windows in the house.
So everything that I need for my
Correct. Yes.
So I'm going to start taking questions from our audience. The first question I have is, can a layperson be trained and certified by Livingston and become a paid caregiver?
We do training for people that we see that have some kind of connection to the medical field, meaning students who are aspiring to be nurses or stay in some field within the medical field, and we will do the training that's needed for them. That's kind of our line there. You kind of have to want to have a role here that's going to take you, at least, if you want to just be a caregiver, that's great. We can do that as well, but we want to see some attachment to a long-term goal for you in the medical field, particularly, with our group, but we tend to hire people who've had some experience. It's been pretty rare that we hire somebody with no experience. And again, those are typically students that are going to be nurses that we do that with.
The next question I have is, where can I get a list of licensed caregiving agencies?
So there's a state website, and that's with the Department of Social Services.
Okay.
If you look up the Department of Social Services and you go on their website, They have a segment of their website dedicated to that, where you can go on and look at all the agencies that are registered. It breaks things down by county, so you can put in your county, it'll give you a good overview. We have about 50, last time I looked, we had a little over 50 caregiving agencies just in Ventura County. Licensed.
Okay.
And it is a good website to go to. It has a home care services, section to it, and it has good information.
The Area Agency on Aging is another good resource for that, because I know they put out literature, and all of the companies that are listed in their literature, caregiving companies, are registered with the state.
And you said that is the Area
Agency on Aging.
Agency on Aging. I want to open the floor for anyone else who may have a question for John and Catherine. Please feel free to unmute, or if you want to ask your question directly, or you can also type it in the chat. That's all the questions that we have. Thank you so much for your time.
Thank you.
Definitely very enlightening, even for me, who's been in the healthcare field for quite some time now. So thank you again. And what we'll do is we'll go ahead and send the list of the licensed caregiving agency as part of the resource materials that will be available as part of the handout for this presentation. If you have any other question that you may, think about after the presentation, please feel free to reach out to us directly. We will connect you with John and Catherine if you for additional assistance. Thank you again. Have a good afternoon.
Thank you.
Bye.